Good afternoon. My name is Kevin McNamara. I'm the CTO and founder for HiveIO. I welcome everybody on this beautiful afternoon, and with me I have our solution partners from GAVS, Guru Bhupala and Rajiv Khanna, as well as an honored guest from BronxCare Healthcare Systems, the CIO, Yvonne Durbach. Welcome everyone. So we'd like to basically have a discussion about the BronxCare transformation that we started about 8 months ago, and it's a desktop journey, and we'd like to kind of walk through the entire story for everyone to listen to, and I'd invite the panelists to just at any point in the discussion, please share their thoughts along the way. So so just at the highest level, if I could just open up HiveIO. So HiveIO is a New Jersey-based company. We provide a software-defined infrastructure, and it's a very simple and elegant and cost-effective transformation for any private data center. And really, we build on an atomic unit that incorporates the ability to install on top of any commodity hardware, and really gives you great value in the infrastructure. So at the highest level, the software is installed on any bare metal. It has a Linux foundation. There's a KVM, network storage, and acceleration, as well as a whole orchestration layer that allows you to connect and manage the infrastructure at present. Also has a connection broker that's built into it, and also has significant features for future growth, which include multi-tenancy and machine learning that allows you to plug right into ecosystems and do some great things. So this is in comparison to a typical three-tier infrastructure, which typically has moving parts, moving vendors, licenses, and really can be composed of storage, compute, and networking. And really the discussion has been in the open private data center markets to go toward a hyper-converged market, hyper-converged infrastructure. The issue is, when you move toward a hyper-converged infrastructure, what typically happens is you're taking all of the vendors' licenses and pieces and putting them into a box. So you're really just taking all those parts, and you still have to manage them, and you still have to pay for them, and they still all the uplift. With Hive Fabric on the atomic unit, all of those layers are flattened, zeroed out, and integrated into the appliance, and you get a really great solution at the end of the day. So that's the highest value proposition that I can describe at present. Would you mind moving to the next slide? Thank you so much. So the other thing that's really important to mention about Hive as a whole, we deliver the solution as a hyper-converged fabric. There are three statements we want to make sure we convey and we stick to, and hopefully it's thematic to this webinar. And they really just speak to the fact that Hive enables customers to simply focus on their business and to get away from the discussions around technology. So most healthcare organizations, as well as most enterprises, are really very quickly moving away from, I need to have these servers, I need to have these vendors, I need to build this network, to the statement where they just simply want to deliver a business value. I want to do my business, how much does it cost, and how quickly can I stand it up? So when we think about that specific statement, there are three things we want to make sure we relay over and over. The first is that IT infrastructure has to work with you, not against you. If you want to deploy something today, you should be able to stand it up on demand and simply work and do your daily business. Second thing is that the IT infrastructure should benefit the economies of scale. So for instance, if today you are a small presence and tomorrow you're much larger and you're growing quickly, we should be able to grow with you at scale. It's a really simple concept, and something that's very difficult to articulate with many of the vendors in the private cloud space. The third thing is that the IT environment should be able to predict in real time where issues and problems come from. The issues that today most organizations, as vendors as well as enterprises, typically react to problems after an issue. We want to build a story that allows you to work with the with real-time things as they come up. Anyway, next slide, please. Thank you. And so when we put these three statements together, really what we're saying is that Hive Fabric simplifies the data center and delivers the scale, power, and security that a healthcare organization requires. And that means that it's not a conversation about private or public cloud. It's not a conversation about how much, how many vendors, what piece of the stack you work with. It's a conversation about delivering an end-to-end solution. And that's really what we're looking to do. So with that, next slide, please. Thank you. With that, I'd like to introduce Guru, who will be walking through the part of the discussion that GAVS brings to the table.
Yep. Thank you, Kevin. Good afternoon, everyone. Thank you for joining this webinar. My name is Guru Bhupala, and I am from GAVS Technologies. And as Kevin was mentioning, we have partnered with Hive and integrated their Hive Fabric into the end-to-end virtual desktop infrastructure offering we have, and which we take it to several customers, including BronxCare Health Systems, which we are talking about today. So we as an organization, are a artificial intelligence ops organization. So we have built smart machines which can, look at your all infrastructure elements and help run them smoothly. We talked about how do you deliver your services in a scalable way, in an agile way, in a secure way. And if you look at our solution, which we call as Zero Incident Framework, which encompasses monitoring, predicting of all your infrastructure elements or all your configuration elements in your IT infrastructure, and predicting any issues which coming out of those infrastructure elements, and also auto healing them using our automation platform. So it is part of the digital transformation journey we take our customers through, and our partnership with Hive is a critical component of it, to ensure that we deliver the ZDesk, as we call it, or the VDI to several healthcare customers. And we are very clearly, positioned as a leader in artificial intelligence ops space by several analysts like Gartner and Everest, and several niche analysts who look at our service offering and are specialized in that. And we work with healthcare customers as a focus area, and we're happy to be here. And as we progress, we'll be through the webinar. We'll be happy to answer any questions on how we have worked at BronxCare Health Systems to implement the VDI solution along with Hive, and any other services we provide there. Over to you, Kevin. Thank you.
Thank you very much. I think the important point to really point out here, Guru, is that together, Hive and GAVS have put together a complete and holistic solution that allows healthcare customers to really take benefit from the fact that it's all encompassing. You roll in a solution, you get the installation, you get the life cycle, and you also get the predictive and reactive care thereafter. And that's the parts that's really important here, and we've done it successfully. And that kind of segues to the next portion of the discussion, which really goes into a very specific use case. And we're honored to be joined by Yvonne, the CIO of BronxCare Health Systems. And I'm hoping, Yvonne, if you wouldn't mind, would you be good enough to just kind of highlight BronxCare as a business, and just give us a picture as to where the hospital is today, and approximately how many people visit the hospital, those type of bits.
Yes, I'm very happy to be here. So our hospital, we actually have 2 hospitals in the central South Bronx area here. We have large emergency rooms. You come to our area any evening, you see 150 patients at any one time. So, and I stress that because high availability is a major objective of all of our technology systems. You see some of the statistics here. We actually do about over 1 million visits annually. The thing that strikes us most of the time is that every day we treat over 4,600 patients. So there's a lot of activity. We're almost paperless. So our doctors and nurses are totally dependent on our technology here. So they really utilize our EMR. Again, virtually no paper. So I tell my IT staff, what do? We run servers, we run network switches, create applications, do the VDI. But at heart, we are fundamentally essential to our doctors and nurses. We really are actively involved with these 4,600 patients every day. Without us, without IT, they can't function. And to a large degree, I tell my staff that what they really do, they really save lives here. So again, a major healthcare organization in the Bronx. We're also a safety net hospital, and that translates into financial constraints. So we don't have a lot of money here. So we have to make do with typically what we have. Maybe if we can go to the next slide. Right. So we have these 3,500 desktops, and as I mentioned here, we have a lot of old stuff. And actually, that third point on the left side, the place where we really started seriously thinking about VDI was about a year ago in the spring. You may remember WannaCry and Petya, when those malware hit us. They hit us hard. And I remember Rajiv was with us, and we were running around like crazy trying to patch obsolete Windows XP machines here. And that was a very hectic time, if you remember, for us. Right. So then I said, we can't afford to have this. We in healthcare are getting battered by ransomware and various malware devices. So we got to do something. So VDI was a logical sense. That's when we really started thinking seriously about going to VDI, with security as being one of our major objectives. So we decided to go with VDI for our desktop management. We chose the Hives GAVS approaches. We looked at a number of different approaches, and we chose them because, one, we were very comfortable with the quality of the technology. It's Linux kernel based and, of course, KVM based here, and it was a cost-effective solution for us. And so what we've done is, over the course of the last 8 months, we now have over 3,000 of our desktops on VDI, 3,000 down, about 5,000, about 500 to go by the end of this year here. And we've achieved a lot. So I think the project has gone reasonably well here. And we're at the time now, we spend the most time with our electronic medical record system. We use the Allscripts EMR system. And that's where, all 3,500 of our users are using that. That's the heart of our technology for patient care. And we see that our users tell us, our doctors and nurses tell us that performance under VDI has improved between 20 and 40%. So that's huge for us, because every second is precious for a doctor and a nurse. When you treat 1.1 million patients, if you can shave off 10 to 20 seconds, that's a huge savings of time. So we've achieved standardization. I no longer have to worry about XP solutions that are going to blow up on me next time that a WannaCry hits us here. And we have, as I mentioned, response time is good, and we're saving money because those VDI devices are a lot easier, a lot cheaper to maintain than standard desktops. And of course, the first point, we've a dominant issue, improve information security. I sold this to my board as under the aegis of security. Maybe next slide.
So Ivan, would you mind if I just pause you there for a second and ask the question?
Okay.
So the question I have, and I've seen this over and over, is that security, when you move away from a desktop where you have all of the moving parts that you have to protect because that desktop or the server is accessible by a physical person, right? That's where so if you think about the security boundary, it's all at where that compute is, right? So on a physical desktop or a laptop, and in fact, the laptop even more so because it's mobile, that security has to be encapsulated. You have to have local storage acceleration. You have to have all of the parts that are necessary so that if somebody were to take a physical drive out of the box or take a piece of that physical infrastructure, you could protect yourself. And so moving away from that into a VDI world where the envelope is such that whenever you go into a session, you're actually not touching data. I think when we were having those conversations with Mr. DeMarco, that was definitely a moving part that was very interesting to you guys. So do you feel that that is something that the hospital system has really recognized as being incredibly valuable in the VDI space as we move through the projects? And do you see that as something that's that is, I guess, more digestible for the hospital moving forward?
Absolutely, Kevin. I'm very glad you mentioned that because we're in the South Bronx. It's a tough neighborhood. We have theft all around us all the time. We lose laptops. We lose even desktops. So I really love the fact that with VDI there is no more local drive C. So that the next thief that comes in steals one of our laptops. Sure, I missed the $700, $800 that we have to replace, but I don't have to worry about PHI, protected health information, on that local drive. That is a HIPAA violation for those of you who are familiar with healthcare, and it's a huge potential penalties from the federal government if we lose patient data, notifying patients. So the security aspects of that, of having no local drive C, is huge for us.
Yep. And so the second question I wanted to ask you, if you wouldn't mind, Ivan, is there was a little bit of hesitation when we were having discussions about VDI in relation to video quality. So doctors typically have a need to be able to peruse through MRIs, CAT scans, X-rays, and there was definitely a worry that when you went to VDI, you wouldn't be able to do that in a really seamless manner. What is the overall perspective from the doctors at present now that they've used the systems for quite some time?
So we had the same question because we always wondered how the technology would function with, video, especially audio, video, those enhanced applications. So our major imaging systems are working just fine. Radiology, cardiology, that's where we have our terabytes approaching petabytes of data. They're working just fine, and again, faster before. So we're very happy. I must say that some older systems around, legacy systems, and that's what we always need to watch out for. So we have a smaller system. We have, as one of our smaller systems, we have a dental clinic here, and they, as an example, they have 8 different systems. Talk separately. Why does a dentist need 8 different systems? But that's a separate question that we're not going to address here. And some of these are very old legacy systems, and that's where, if you remember, Kevin, we had some of our bigger challenges here. But they're all up and going. They're happy now.
Yeah, this was, and Ivan, I got to tell you, for me, we were very interested to see how the doctors would really use graphics, and I was able to see a couple of doctors go through MRIs and go through all the slices. They just roll through them seamlessly, and it felt like a very, very good fit. So thank you very much for answering those questions, Ivan.
Okay. Any other questions?
I would say that's the other question I had in the premise of that slide was how you felt. Yeah, I know there's an expectation for a rollout plan, and I know we'll get to this later on. But I wanted to get a sense from you how you felt the overall rollout for VDI was after the fact versus what you expected it to be in the beginning. I know there was a lot of stories from various vendors where VDI could take an eternity. Application deployments, physical layouts, all that stuff was definitely a problem for a lot of vendors. How did you feel the VDI rollout went for you guys? And was it better than your expectation? Was it on par? How did you feel about it?
Generally well, and I must say that actually our preparation for VDI was actually in the opposite direction. The vendors who were trying to sell us various other VDI solutions, salesmen being what they are here, they were very, very, very optimistic. We had promises of smooth, effortless installed, done within weeks sometimes. So, having been in this business for several decades, I approached all that with caution and as well as skepticism. So, but the main application we have here is our electronic medical record, where we push through our 4,600 patients every day, and there the doctors and the nurses have been very happy. So from that perspective, this has been a success.
Fantastic. And then just one final thought that I think would be important and relevant to the discussion is I know that there was also some questions early on about image management. So having the ability to deal with zero-day vulnerabilities, having the ability to make updates to the images for the 3,500 users. I know before it was a discussion about going to individual desktops and laptops and pushing changes. And now, if you could just tell me how your world has changed since you've implemented VDI.
Well, it's similar to the security discussion a few minutes ago. Now, since it's all sitting on those 36 servers, any patches, any management issues are done at the server level. I don't have to worry about running around to 3,500 devices. So that's a major driver for why we went to VDI in the first place, and that has worked well.
Fantastic. Okay. Well, I'll stop asking questions for a minute, Ivan, so you can get on to the next slide. I appreciate it. Thank you.
Okay. We're talking about the Zdesk solution. We're getting into some of the nitty-gritty about hypervisors and brokers here. We use, of course, data encryption, which is important to me from a HIPAA perspective. But the basic technology works. As I mentioned, it's based on the Linux kernel and KVM here, and I really have nothing to add to the technology.
Oh,
the
fantastic.
technology works fine.
So I guess from this slide, when I think about the solution itself, so just so we can reiterate what the solution is: on-premise with dedicated offsite servers and remote data center. Data replication is part of the overall plan. So the expectation is that when a user writes data to a drive, that data will be there the next time they log in, regardless of where they are in the infrastructure. The expectation also is that if we were to have a data center outage, resilience is there in place so that you can get back the data. The delivery of the service storage, acceleration, orchestration, thin clients, connection brokering, and RDP are all included in the solution. It's a really key factor here. So if you think about typical discussions around virtualization, specifically around desktops, it's always about what vendor plays in what space, who's going to drop it in place, who's going to configure it, what software's got to go in for the VDI piece, what software's got to go in for the server piece, what software's got to go in for thin clients. All of those parts were part of the solution. This is something that GAVS partnered with HiveIO put together as part of the solution in Ivan's organization. And then the other thing that's really critical is where GAVS steps in. They've really done a fantastic job of managing the end-to-end IT infrastructure. Of course, there's the third-party elements for security that are typically incorporated. So we do an Active Directory integration. We also enable the ability to do single sign-on, multi-factor, and that's all included in the process. And as Ivan had mentioned before, we have user data encryption. And then the most important part about the solution is that it's an end-to-end, hands-free support Zdesk infrastructure model. So I also wanted to introduce Rajiv Khanna, who is the IT director at Bronx Lebanon. And I'm wondering, Rajiv, if you could just maybe fill in some gaps I may have missed on this slide.
Absolutely. And good afternoon, everyone. This is Rajiv here. Thank you for attending the webinar. So in terms of the solution, and one of the key things that we really looked at the GAVS Hive solution was about the overall end-to-end aspect of the implementation and deployment. What stood out for me from wearing the operations hat is that I am able to run this with the same set of resources, and the training that is required to run the VDA infrastructure, unlike Citrix or Horizon View, is very minimal. And to the fact, 80% of my VDA operations is actually handled by my tier 1 support team, and only the gold image management and cluster management is indeed handled by the core tier 2 and tier 3 teams. So that is one of a very, very important factor, because we were able to be on our own within the first week of our POC, and we were able to play around with the tool, whereas with Citrix or VMware, there is a learning phase and a lot of training that needs to happen. And along with that, we also needed VDA management suite like Unidesk or whatever. And what we were pleasantly surprised is we have a management console that handles end-to-end VDA management without having to deploy any other vendor products or third-party commodity into the mix, which stood out for us during our selection process, Kevin.
Fantastic. Thank you so much. Appreciate that. So, so basically this kind of describes the overall solution. It describes exactly, how we deploy this, the moving parts that I believe are relevant to this discussion. And so what I'd like to do is walk into the next piece of our webinar, which is to discuss the business benefits and the value that it brings to our general population of customers, but specifically to the healthcare verticals, and then specific to the BronxCare installation. Would you mind, Kamesh, just going to the next slide? Thank you so much. I think the important thing here is that business benefits, typically derived by the fact that the HiveIO infrastructure is minimized of any complexity first. That's the first thing. The second thing is that we reside on top of commodity hardware, and also we have reduced and removed all of the layers. And then also the overall benefit is that with the partnership that we have with our partners in GAVS to provide an end-to-end solution, we take all of the moving parts, very streamlined, commodity hardware, streamlined infrastructure, and streamlined services, and we provide an overall experience for our healthcare vertical that is bar none to any in the industry. So, a couple points to kind of talk about. The expensive Capex investment turned into an affordable monthly OPEX cost. So I want to just ask if Rajiv could just step in and kind of walk through exactly what that statement means, because I know, Rajiv, you and I have had many a discussion on the phone about Capex to OPEX conversion and what it means and why it's so critical.
I think this is Ivan. If I could just take a quick moment. We're all moving towards IT stuff as a service, and what that means is a steady monthly stream of cost or revenues, and we've taken that. But I would, I took and interpret this as being a major value to our organization is that it's going to reduce costs, which makes my senior management and board and CFO very happy. So that's one aspect of that. But the first and most foremost is your third area that I'm looking at, because my doctors and nurses and all the other end users, they're experiencing better performance, and they're very important. The boxes don't break as often. Regular PCs where you get 3 or 4 years of use, frequent downtimes. These VDI devices, they're small. They last, I hear, up to maybe 10 years or so, and they have fewer moving parts. So that's great in terms of really a highly reliable device. And you've got also there, the third huge benefit from us is from a security and HIPAA point of view, as I've mentioned already.
Fantastic. Thank you so much, Ivan, for stepping in on that. So, so the other thing I kind of wanted to call out as we kind of walk through this is I wonder if we could have a discussion around the financial incentives from the federal and state entities for improved energy efficiency, because as we know, when you take say 3,000 laptops or desktops, and you look at the overall power plan for those 3,000 versus taking 3,000 users and putting them into 36 servers with high efficiency parameters put around them. it really does make a huge impact in the overall benefit to energy efficiency. And that means significantly less cost when it comes to data centers. It also means, as Ivan had just alluded to, very minimalistic moving parts at the endpoint that require very little power and last a lot longer. And so those are the kind of things that I think really have great value to customers, specifically in the healthcare vertical, because these are huge wins across the board. So Ivan, how do you feel about the overall benefit to you and to the hospital from an energy efficiency perspective? And are there any federal programs or entities that we should be, kind of thinking about as we go through this?
Yeah. So this is Rajiv here. I take that answer. Yes, we do have state and federal funds that are ready to give back if you save energy. In fact, we are actively working with NYSERDA, which is the New York state body that actually is looking at cost energy optimization, and our VDA project has been approved, and we are working with them to see how much would they be giving us back in terms of the energies that we have saved at the client location in the Bronx, as well as at the power consumption and reduction in power consumption at our data center location back in New Jersey. So we are actually involved with New Jersey also has a similar funding that is going on, and we are looking at thousands of dollars in refunds from the government after we go through the process. The process is tedious. They go through the validation exercise, and then they measure the kilowatt per hour savings, and they give us, for every kilowatt per hour savings that we did, they give us up to 25 cents, which can figure out over the next 5 years into thousands of dollars.
We actually think, this is Ivan here, that this will save us over the course of the next 5 years, possibly several hundreds of thousands of dollars. Because energy costs are big and huge. As Rajiv said, it's a slow-moving process. Federal government, state government, it's a bureaucracy effort. But so the savings won't hit us perhaps for another year. But we take the long view. Our healthcare system has been in existence for 127 years. So that if we have to wait another year to save all these dollars, it's okay.
Yeah, these are fantastic points, and I appreciate the responses. Again, I want to just reiterate to the audience, this speaks to that kind of second bullet I spoke about before, which is that IT infrastructure benefits from economies of scale, right? So we allow for benefit as you increase in our portfolio. And then, so the last kind of area I was hoping to focus on, and I'll take the answer from either you, Ivan, or from Rajiv, and I seem to be calling out the wrong person every time, is the Follow Me desktop. So having that really great benefit to be able to pop into a session. So I'm a doctor. I pop in and I'm doing some work at a station. I go to another station. I do a little bit more work, and that experience follows me from station to station. How has that transformed and changed the way the hospital does business, and how do you feel moving forward that's really going to be valuable for the overall patient and the experience in the hospital?
It saves the doctor time. So the doctor may be treating 5 patients at the same time and is bouncing around between 5 different exam rooms, and to be able to get back and launch instantly into the session where he or she was 10, 20 minutes ago is just a big time saver. And time is everything to our clinicians.
And actually, I was pretty surprised working with the healthcare environment. People resist to change, but when we showed the first phase of our product and showed it to some of the physicians and the residents, they actually really wanted this product to be deployed soon, because for them to be able to roam across multiple locations and the different floors and maintain their profile or the session was tremendous, and they didn't have to log in, they didn't have to reconfigure their printers. So the printers, the profile, everything followed them, and that was very, very important success factor that also was one of the important aspects for any VDI deployments, is to be able to help the end users accept the change and actually enjoy it, which is something that we were pleasantly surprised.
Yeah, it kind of causes a different set of problems because as soon as we got VDI up and going on 2 of our nursing stations, and the doctors, there and say, "Wow, it works! It's faster, it's better. I can bounce around to different patients a lot more efficiently." Then the word spread like wildfire. So then the other nursing stations and floors and the others, physician service chiefs all started to come after us and said, "I want VDI. I want it now." So that it increased the demand tremendously. So we had to explain to them we have a process, a systematic way of rolling these things out. But yes, it's been done very, and of course, taking that gradualist approach, first bringing it live on 2 nursing stations, making sure the doctors were comfortable, and the word spread like wildfire.
So
Yeah.
I don't know if that's a good thing or a bad thing for you, Yvonne, but yes, I have heard that over and over.
Yeah, I'd like to add 2 other components that we didn't touch base, Kevin, is that we have about 18 plus sites, of which there are some minor sites that were running on 5 meg or 10 meg connections. We were actually skeptical and we wanted to actually increase the bandwidth on those sites. But actually speaking, we are able to maintain or actually our reduction in bandwidth has been reduced even at the smaller sites because of the traffic is now between the server and the client, which is actually within the data center. So I don't have to send in a lot of data from Bronx back into our data center, which has also been an indirect savings for us because our expansion on bandwidth has been put off hold because we now have 40% capability on every site where it was peaking at 100%. That is another indirect that we need to take into account in terms of your TCO and ROI.
Yeah, it's an absolute valid point. So I know that discussions in the past have been when you discuss desktops that are virtualized, the worry that we're going to need more bandwidth because you're proliferating a video message from an endpoint to me, and you're doing this on a consistent basis. When you actually look at the overall topology and the way that the infrastructure works, the application to desktop communication can cost anywhere from 2 to 4 times more than just a standard video connection from the actual server to the endpoint where the user is consuming the VDI. And that's a pretty significant departure from the discussions of just a year or 2 ago. We also have leveraged significant benefits in RDP, which is the standard Microsoft protocol, that allows you to benefit even more as the protocol matures even further. And so you get really great video quality, you get really great experience, and you also get really great benefit at the data center for the network connectivity. And so, you couple that with the any message, which is what I like to call it, anywhere, anytime, on any device you can consume a desktop. That's a pretty fantastic statement that gives you great value. So Rajiv, you said there was one other point that you wanted to cover?
Yeah, in terms of the end user experience that we saw, there were some legacy applications that we were worried about how the performance is going to be. Actually, the legacy applications turned out to be the biggest beneficiary of the VDI because there were cases where imaging application that took over 40 to 45 seconds per transaction was reduced to about 10 seconds, and the ability to customize that and fine-tune that at the server level and allow users to connect to it through the VDI has proven pretty much important and beneficial for us.
Fantastic. That's a very important point to mention as well. So So beyond the business benefits, we wanted to just come back and kind of summarize what we've just discussed and what Yvonne has been good enough to walk through for BronxCare, which, if you wouldn't mind, Kamesh, just go into the next slide. Thank you so much. So, in summary, the overall benefit post install at BronxCare is that you have an overall improved user experience. I can tell you definitively that I've sat with nurses at nursing stations, doctors. I know that Rajiv has on numerous occasions, and so has Yvonne. And the overall experience has been better, and everybody has remarked on that, which has been great. The reduced OPEX cost is fairly significant. We've gone into a couple of touch points on that between the energy efficiency, the number of devices, the consolidation, the security aspects of it. That all goes into that picture. The HIPAA ready, coming back to the demarcation of where that security line goes. So if your security line falls within the preview of somebody being able to carry a physical device, then that's not really such a great point to be at. But if you move that security line into a server and you're just basically looking at data as opposed to, interacting with it physically, that really reduces that HIPAA issue in a significant way. The fact that you have a single stack, which is it gets rid of that whole multi-vendor licensing, as well as the complexity. If you think about it, every single vendor in a stack requires an operations, requires an engineer, requires an architect. All of that goes away. The fact that we've reduced that in a significant way as a partner across the board, from the installation to the life cycle to the services, means that it's easy to manage end to end. So it's really all about, again, coming back to that value statement. We allow our businesses to be able to do what they do best, which is their business, and to get away from being technologists. Huge benefit. And then having the ability to be flexible and scalable. I can tell you that we have worked with the BronxCare teams on the weekends to install 100, 200, 300 additional desktop sessions, and it's happened multiple times and fairly seamlessly, and that's something you can do very quickly. I can tell you that there's been times when we've had to work with the teams to help and secure patches and do things that are last minute, and that's very flexible. So all those things really speak to those 3 bullet points, which are: we allow businesses to do what they do best and not let technology get in the way, and really gives you great value. So with that, I want to make sure that Yvonne has another word should he want to add to that, and then Rajiv as well. So Yvonne, would you mind if you have any other questions or thoughts?
Well, I think you've said it all, Kevin, pretty much. The only thing that I would like as a summary is that we at BronxCare here with this new technology, we're in a better position now than we were 8 months ago.
Fantastic.
And that's volumes.
Hey Yvonne, I have a trick question for you, if you wouldn't mind. If you were to do this again, would you do it differently, or how do you feel about where you are in the world today?
Probably a standard kind of, a common response to that applies in this case also is the extent of testing. Because way back, our electronic medical record system is the heart of our technology, and we tested the hell out of that. We made sure that everything was right, all of our different functionalities, from the registration to the clinician to the nursing functions. We tested it all. It worked fine, no problems. We have 30 other systems, many of them small and legacy systems, and with all the other functionalities. I think of the patient consent process. I think of the scanning process. Probably have another about 20 functions. So these other 50 systems that are smaller, again, older, around, we did a fairly quick and cursory test. We're in a hurry. We have limited resources. If I had to do it over again, I would spend more time to test everything, even a small, tiny system that may only have 10 or 20 users in that, in order to save any kind of questions or pain or agony that may surface. That's about the only thing that I would do differently if we were going through this process again, Kevin.
Fantastic. Thank you so much. So Rajiv, would you like to add more to this?
Not really. Extensive testing is one thing, and the additional functionalities to be able to think through future needs could be something that I would play more focus on, because with this change happening, what we do right now may not be sufficient 6 months, 12 months down the line. So maybe that's something that I would definitely focus to have the future technologies adapt to it. And I know you have promised me that the software is flexible, and we would be able to take care of, for example, GPU virtualization and stuff like that for our users who use AutoCAD or 3D. So right now, I know we are excluding them, but things like that, I believe through software updates is capable from your current current software package. So like that, I would like to focus more, but the deployment strategies may be a little bit different. But I think I'll go with what Yvonne said with testing and going for it.
Sure, sure. And to be honest with you, so the graphic capability is built into the stack. All the drivers are there, so we can expose GPU in the order of AMD, NVIDIA, as well as Iris Pro. And then when Bronx is ready, we'll simply allow you to virtually slice the GPUs for the 3D applications you're speaking about. So all of that is included in the system. And yes, it will be something you can upgrade seamlessly into. So that's great. Guru, I haven't picked on you in a while, so I know you've heard the discussion along the way. Do you have any thoughts that you'd like to add to the closing of this discussion before we move into Q&A? I think maybe Guru's on mute.
Yes, yeah. Sorry, I'm on mute, Kevin. And you were asking me a question. Sorry, it was a little garbled.
No, that's okay. I was just asking. You've heard the entire seminar,
right.
And we're to the close before the Q&A, and I'm wondering if you have any thoughts or that you'd like to add to the discussion, or any questions.
Yes, yeah. So thank you, Kevin and Ivan and Rajiv. Great discussion, and I think the only question or a point I wanted to make and ask Ivan is, Ivan, you in the initial side, you talked about the business benefits, and you talked about cost savings, and you talked about how cost is an important factor. So when you talked about 40% savings compared to the other partners or other vendors you evaluated, I presume you didn't have to sacrifice any of the functionality or any of the features you're looking for in a VDI solution, right?
If we had to sacrifice something, my doctors and nurses would have killed me.
Right. So I think that's a big value as well. I think from the solution, the business value which we derived out of the solution, in terms of it met or exceeded your end users' expectations, but at the same time delivered a significant value. And what we are seeing, Kevin, you and I know that wherever we are putting across this comprehensive solution, we are at least 25 to 30% competitive compared to most of the guys out there. So I think that's another value add, I would say, from not for BronxCare, not just for BronxCare, but any other healthcare customers who would like to look at this.
And Guru, this is Rajiv here, and I strongly believe that that cost savings comes in from the underlying infrastructure cost to run your solution was drastically low compared to the other solutions that we actually looked at. So the storage, the compute costs of running the Hive GAVS stack compared to the other stack was considerably less, which attributed to that savings. One of the key reasons is what I see wearing an operations hat.
That's right. Yeah. Thank you, Rajiv. Yes.
Fantastic. All right, so I think we're at a point right now where we can move into the Q&A section. We have about 10 minutes until the close. And what I'm going to ask is if Kamesh, who is was doing all the background work and making us look good. If you could just feed us the questions from the audience, and then what I'd like to ask is maybe if Rajiv, Ivan, or Guru, if you could help in answering some of the questions coming in from the audience. Appreciate that.
Sure.
Great.
Thanks, Kevin. So we have some interesting questions from the audience. The first question is, how is the solution different from Citrix or a VMware? What is unique about the solution?
Okay, fantastic. I can certainly answer that, or Rajiv, if you have any perspective on that you'd like to add, I'll let you take the first stab. It depends on how you feel about that.
This is Ivan. If I can just jump in very, very quickly, that we looked at both of those solutions, because you identified the other big players in the marketplace. We thought that the Hive GAVS solution was first and foremost simpler than those other solutions.
I agree.
And so simplicity was a factor, and then of course there's big cost savings in that. So we're very happy with the decision that we made.
Yeah, I mean, for me, that's the important factor from an operational perspective is I didn't have to really worry about taking on a beast and with already overutilized resources in terms of projects and whatnot. I did not want this to be a burden, and that, according to me, was the very important factor. And the fact that it is so simple that my service desk team is able to answer 60 to 70% of my operational issues is something that is very encouraging, that allows my core team to work on other projects, which is never ending. That's one thing. And in terms of the features, when we did the POC, the performances and the response times were on par with Citrix and VMware, which in case we did both of the vendors' POCs as well. So that was very good. So we didn't see any difference in that. And I actually didn't have to implement a Nutanix or a SimpliVity as my hardware infrastructure, and I ran it on a typical 1U server, and then brought in the hyper-converged aspect from the software, which is the dedupe and compression and the various good things. So these are the few things that I think were unique, wherein which I didn't want to look at other products or modules. So this was an all-in-one module. Once I get it, dedupe, compression, and everything came up. And the fact that I'm not sure if Kevin you had told about the architecture. The fact that I'm able to use the RAM storage to actually run my guests proves to be extra beneficial for me, not to use my storage or memory and deliver faster performances without compromising the thing. The RAM running the guests is something that I liked it pretty much.
Which I think flows with the concept of infrastructure that works with you, not against you, right? So think about that. But so just answering this very, very succinctly from my perspective, when you compare us against Citrix and VMware, first of all, there's no management. It's all integrated into the stack, which means that there's no setup time. So for Rajiv, it means that if he wants to deploy a new data center, he doesn't have to set up virtual centers and database boxes. He just simply says, here's a server, drop Hive on it, have GAVS run the services, the infrastructure, the end-to-end artificial intelligence on it, and you're up and running. That's what it means straight out of the box. It's a very quick turnaround, very simple to deploy. There's zero you're giving up on performance, as Ivan had mentioned before. If he were to give up anything, he would be, absolutely taken to task on it, and that's something that he has not at present. So the performance has to be there, and all of those measures are met. Disaster recovery, all the most important architectural benefits, they're all there, and of course the overall deployment is much simpler. So that gets you to a good endpoint, and that's my perspective on it. So Kamesh, do you have another question?
we have a lot of interesting questions, and I think some of the questions you already answered, but I would like to reiterate on one of the question here. The question is, do we need any proprietary hardware to run the solution?
Short answer, the answer is no, and there's a really specific reason for this. Hive is architected as 100% software defined. There is no dependency on ASICs, RAID controllers, GPU cards, all the things you typically will hear from various vendors in the industry. So there's no need for a specific BOM, specific kits. We simply can be installed on top of any commodity. That's great value, because really there's one simple fact. Every data center in the world has all types of equipment in various stages of accounting life cycle. So the expectation is you should be able to consume that and use that at any point.
Awesome. So we have a question, I guess this would be more for Ivan and Rajiv. How is security handled at the server and the client level?
I'll take the shot. So from a client level, we deployed a thin client with the Windows 10 IoT. We specifically chose that for some of the Microsoft licensing requirements. With Windows 10 IoT comes in the capability to restrict the operating system to a read-only mode. So all of our thin clients at BronxCare right now is running Windows 10 IoT with a read-only operating system, which means any read or write that is happening gets lost with the reboot of the thin client, and we did not have to spend on antivirus softwares or endpoint softwares on the thin client. We went on with the Microsoft firewall and the Defender with the read-only operating system, plus a little bit of customizations with the GPOs and the network. So none of our thin clients are right now connected to the internet, and the GPO restricts any local access to any of the services of the system. And finally, these thin clients are also not joined to the domain, so we are keeping them totally separate. So from that perspective, it is totally secured, and by the network and no internet, it makes it a lot more easier for us.
Great, Rajiv, thank you. So we have a question.
Hey, Kamesh, I just want to add one more thing. The infrastructure is set up in such a way that we can allow our customers the ability to set up their own multi-tenancy, and that means full isolation of Active Directory, of the storage, CPU, network, and memory. They're fully isolated, so you can set up line of businesses, you can set up specific business units within the hospital, as for instance. You could have HR right next to nursing stations on the same server, and they're fully isolated.
Great. I think we have 2 more minutes, so I would add this as a last question. IOPS has always been a potential reason for VDI performance issues. How does the solution handle the IOPS issues?
So I could take a quick stab at this. So the infrastructure basically handles IOPS in a very unique way. First and foremost, it's not just about a very fast disk. It's not about deploying just to RAM. It's about putting that concept together along with deduplication and compression, and also doing the work before the wire. So for instance, if you look at a traditional NetApp, or if you look at any other traditional NAS filer, you send a file through the network to that filer, and then it does a whole bunch of work to reduce it down to something really tiny. What we do, which is really unique, is as you write the file in line, it does the work before the wire, before it sends it to the remote point. Therefore, it's a lot more efficient on networking as well as in storage in the remote site. And that's really huge. And we do this in a really unique way because we do this in line. There is nothing to set up. It just happens as you use your VMs on the fly. I don't know if Rajiv, you'd like to add any more to that.
Actually, IOPS so far has not been a problem, but we went in, even though we had the We do have a Hitachi SAN that handles clinical, and then we have a pure storage array that handles certain unique high intensive applications. But to my surprise, we have only used them for profiling. I have a 2 terabyte NFS share that handles my gold image, and the rest of the things are handled by the internal storage, which is actually all the 36 the different clusters that I have. I'm able to utilize the locally installed storage on the server to run the show, and we went in with the SSD disks on the local server. So far, performance have not been a problem. My typical first-time user to load their Windows profile is about 15 to 20 seconds, with a second to connect every since then on. So IOPS so far has not been a problem. Between the different methodologies and the dedupe and compression, I haven't seen any issues.
Perfect. So, Kamesh, I'm going to suggest we close the webinar because we're at the top of the hour, and I just want to remind everybody of really the discussion points. We want to just highlight the fact that, with our partnership and the solutioning, we basically allow our customers to work with IT infrastructure, not against it. We also allow our customers to see the benefit and reap the benefits of economies of scale. We had some discussions around that. We also will allow our customers to move away from being reactive and toward a world where they can get to their business, and that's really what we want to do. I thank everybody for participating. Yvonne, Rajiv, and Guru, thank you so much for the time. With that, I leave everybody to the rest of the day. Thank you so much.